One of the regions experiencing an increase in the number of COVID-19 cases. Let's check the situation from Doctor Eloisa Pornillos. She is the immediate past president of the Philippine College of Physicians in the Bicol Region. Good morning, Doctor. Thank you for taking our call.
Yes, good morning.
Doctor, how would you describe the situation in Bicol right now? Medical groups are supposedly calling for a stricter quarantine status. What is it like on the ground?
Yes, we have here 3 referral center, government facility or government hospital where we refer our COVID moderate to severe COVID cases. But now they are all full. Patients are lining up for available rooms, and the patients are now worrying where they will be admitted. The private hospitals have also full in capacity, so that's our situation.
Doctor, could you tell us which cities exactly in your regions are the ones that are experiencing this and that you're watching closely?
It's the Naga City, the Legazpi City, Camarines Sur, Sorsogon, and the nearby provinces and towns.
Now, how would you describe the hospital utilization rate? 100% na po ba, Doctor?
Yes, it's 100%, and we don't have enough ventilators for the COVID patients who were intubated. We don't have enough the gadget, the high flow nasal oxygen, and some of our patients will have to line up several days prior to be transferred to ICU. We don't have space for the ICU now. And our patients in the private hospitals that is supposed to be transferred to government facilities where the necessary gadgets, equipment are available. We cannot do that because they are all full.
Doctor, when did you notice this surge beginning in the Bicol region?
So actually, the surge was noticed about 4 to 5 months, and I knew the Department of Health here has been lobbying for a stricter implementation of the quarantine guidelines, but apparently this is all we have.
Doctor, would you know if which particular variants were found in the patients in the Bicol region?
We don't have much data on the variants here in Bicol.
All right. Now, you mentioned about 100% utilization rate of the hospitals. How are you in terms of healthcare workers? Are there enough in your area?
At the government facilities, we have enough nurses, healthcare facilities, because in the government hospital, we actually have items or positions that the nurses can take when they apply for the items of nurses or healthcare assistants. But what is suffering right now is the private hospitals, because the nurses are going to the government facility or to the government hospital because we know the pay is better in the government hospital. So what suffers now is the private hospitals. In fact, in Iriga City, one of the private hospital owned by sisters of Congregation of the Sacred Heart of Jesus extended the facility for the COVID ward. Mm-hmm. But apparently, we cannot use the rooms because we do not have enough nurses.
Right, that is a big problem, certainly. Well, keep safe out there. Thank you very much, Dr. Eloisa Pornillos, the incumbent president of the Philippine College of Physicians in the Bicol region.